Hello friends, I am Dr. Ganesh Mathan, Senior Cardiologist from Omega Hospital, Gachibowli, Hyderabad. So today I have been asked to talk about symptoms of heart diseases, particularly heart attack. What is the most common symptom of heart attack? I would say the most common symptom of a heart patient is no symptoms. If a person is absolutely asymptomatic, I am worried, does he have a heart disease? The second common symptom of heart disease is breathlessness. People feel that they are breathless when they walk. They go to a physician, they go to a pulmonologist, and they get treated for a long time. Finally, by the time they end up with a cardiologist, they are in a very literally bad shape. Heart diseases, the commonest symptom is no symptom, and the second commonest symptom is breathlessness. Please understand this. When you are breathless, meet a cardiologist. Chest pain, the classical chest pain which the textbook describes, you have seen in the movie, the person keeping his hand like this, sweating and giddy, radiating to the arm, back pain, collapsing. This happens out of 100 patients in only 5 people. And those people are the lucky people, because even a roadside bystander, a 5th standard kid will say, this guy is going through a heart attack, please let us help him. And that guy is saved, he is taken to the hospital. But rest of the things are not identified. People may have a kind of a giddiness. You go to a neurologist, very good. It is one of the most common area where giddiness happens. But do you know, heart diseases can also present as giddiness. Heart attack can present as giddiness. People who have been having chronic gastric pain, sir, I have 10 years since ulcer, sir, they have diagnosed, they have done an endoscopy, ulcer is there, I am taking. Last night also the same ulcer pain came, sir. It can be a heart attack. Remember that. Increase in the frequency, severity and duration of your pre-existing other diseases can be a heart disease, heart attack. Gastric pain was never this severe, sir, but yesterday it was like, I thought I am going to collapse. It is a heart attack. I took my usual dose of tablet, not 1, 2 tablets. It did not subside. It can be a heart attack. Sir, I have been having neck pain for the past 10 years. MRI has been done. Sir said doctor has said I have cervical spondylitis. So very frequently do get this pain. But yesterday the pain was so severe, sir. It can be heart attack. So these kind of symptoms where the heart diseases mimic other organ symptoms is called mimetic effect. It is like an, it mimics the spondylitis, and it mimics the gastric ulcer symptoms. Severity, duration has to be considered. Not responding to the normal course of treatment, please don't wait until morning. If you are having sudden severe symptom at night, rush to the doctor, get an ECG done at least. Lot of people have waited, tomorrow why should I disturb my family members? Let me go in the morning at 9 o'clock. Out of 10, 2 people have not seen that next day morning. So please don't ignore these kind of symptoms. Any kind of symptom from your umbilicus up to the jaw, front or back, right or left, can be a symptom of heart disease, heart attack. Right elbow pain, severe pain, movement is not restricted and still you have pain, it is not an elbow joint pain. If the elbow joint is aching, the movement will be restricted. He cannot move his elbow. Here the movement is free, but he says, about severe pain, I have now no history of trauma. As soon as I sit, I rest, it is gone. When I start walking, again the pain comes worse. It is an heart disease symptom. When I walk, I get a back pain, that could be. So anything that is exertional can be an heart disease symptom. I eat my food, after eating my food, I have severe pain worse. It can be gastric, definitely yes. But you take your Pantocid, you take an anti-gastric tablets, and despite that the pain is there, it could be a heart disease symptom. That is called postprandial angina. When you do an angiogram to these patients, they will have a 95 to 99% blocks. So in the course of last 30 years in practice, we have seen lot of protein presentation of heart diseases. People across their lifestyles with different kind of symptoms have come, and we have seen that was the symptom, and on the table we operate, we open the blocks, and he says that the symptom has gone. Elbow pain, that lady comes, going around to the orthopedic for 2 years, then finally comes here, we get an angio has 95% block. I tell the patient, I don't know whether the elbow pain is because of the block or not, but 95% needs to be addressed. She says, yes, okay, please do that. We open the block, and that night when she's eating and walking, she says that the pain has disappeared. It means that was the block which was causing the pain. People comes with jaw pain. They go to a dentist, they go to an ENT, they see everything has been clarified and classified normal. They say, sir, I get jaw pain severe. Jaw pain is a very classical symptom of heart diseases. Remember that. Tooth, caries tooth, okay, right, that is explained. But the jaw pain is a very classical presentation of heart disease. Please do not ignore that. So, please don't wait for symptoms. What are the symptoms of heart disease? I am telling you, but remember, the commonest symptom is no symptom. And the first symptom can be sudden cardiac death. A heart attack sometimes doesn't give time. Out of 100 heart attacks, what we see, at least 20 people die before reaching the hospital. And that is their first symptom, sir. Until yesterday, last night, he never had symptoms. He is such an active guy. Today morning, suddenly he said, I am having pain. And within 10 minutes, he collapsed. So please do not wait for the symptoms to happen. Or if you have these kind of symptoms, please meet your cardiologist and they will take an appropriate action and suggestion, and we can help you lead a healthier and longer life. Thank you very much.